Hey everybody, how are you today? Jim Prusak, physical therapist and owner of the Pain PT here. And we're going to talk today about reverse psychology and how this can help you with your pain, with your anxiety, depression, any uncomfortable feelings you're having, emotions, stresses. And what this is actually 180 degrees different than what we normally do with something that's uncomfortable or something we don't like, right? So normally we want to get rid of, or we try to stop, or we try to change what's happening either in us, whether it be a symptom, a pain, an uncomfortable feeling, or an emotion, or things happening around us that we don't like, stresses, worries, concerns. And so, what this approach does, this reverse psychology does, is it brings us 180 degrees in the opposite direction. So, the opposite of doing what I just mentioned is actually inviting in the very things we're trying to get rid of. So, inviting in your pain, inviting in your anxiety, inviting in your depression, inviting in uncomfortable emotions, feelings, stresses, worries, concerns, thoughts, even, is to actually do the opposite of what we do. And when we do that, it has a special power of weakening that thing. It's like we are standing up in a sense and saying, okay, bring it on. I've got pain in my shoulder. Sure, give me more pain. It doesn't matter. I've got anxiety. I feel panic. Okay, raise up the panic. Let's go. Let's bring it on. When you do that, it's sort of like you call your bluff in your nervous system, and it actually does the opposite of what we think. It actually backs down most of the time when we do that, versus when we fear something and we try to avoid something or we try to fight something. Typically that actually enhances or elevates the very thing we're trying to get rid of, like symptoms, uncomfortable feelings, stresses. And so this reverse psychology approach is called paradoxical intention, and it was actually founded by Viktor Frankl, who was a psychologist back in the day and also a Nazi concentration camp survivor. And this paradoxical intention is meant to use the power of reverse psychology to change things that we don't like. And it's based on the principle of no resistance, which I love to talk about. And I always say, and you've heard me say before, is what you resist persists. And so with this type of work, we're dropping our resistance and we're actually inviting and calling in the very thing that bothers us. So we're actually opening ourselves up to experience more of it. And the reason why it works is because it's almost as if we open our nervous system and we reduce our tension in our body and we allow more flow through us. It's almost as if we're taking a kink out of our hose by not resisting it anymore, and whatever ails us can start to flow through us and out of us. And so that's how I liken this approach. And you can think of it this way. Now, if you take the other approach, like, okay, don't look at the elephant in the room. What are you going to do? You're going to turn your head and look at the elephant in the room. Don't do this, don't do that. And when you tell somebody these things, what do? They want to do the very thing you tell them not to do. And so it's based on this principle here. And it's sort of like, and I hear this from patients and clients, people actually jinx themselves as well back into their pain. They start to feel better and they say, oh boy, I can't believe I'm feeling so much better. Then boom, the next day they get hit with more pain again, and sometimes worse than before. And I've seen this happen many, many times. So I guess this whole premise of knocking on wood, there's something to it. And we want to, open ourselves to what we're experiencing and feeling, because this is not dangerous. Now, paradoxical intention is not meant to be used when there's actually a real danger or a real threat. You wouldn't do this, okay? But we know with chronic pain, we know with feelings, emotions, that these are actually things we're supposed to experience and actually feel. And we can allow these things to happen. We don't need to try to stop them. And the very fact of trying to stop them is usually what keeps it going. And so let's think about reverse psychology. Let's see if you can apply this to your life, starting right now. I'd like you to see if you can open yourself, invite in the very thing that you're feeling. Notice your resistance at first, which most of us have to what you're noticing in your body, whether it be a symptom, whether it be fear, anxiety, other emotions, and see if you can flip it around 180 degrees and say, okay, no, instead of resisting this or wanting this to go away, I'm actually going to ask it to come in more. I'm going to invite in this thing and say, okay, come on in. I'm going to open the door to it. And usually when you open the door, it's going to come in, but it's also going to leave or lessen. It's only when we keep the door shut and our pain or our emotions are knocking on the door, and they keep knocking and they keep banging, and they won't go away if we don't drop our resistance and open the door. We don't let them in. So again, there's nothing to be afraid of here. There's nothing to be concerned about. This is a brain and neurological issue through the nervous system, a signaling issue. It's not a structural issue of damage like a broken bone or a pulled muscle or ligament. Those things heal, and they heal in an appropriate amount of time for the body. So give this a shot, everybody. This is really powerful. This has helped a lot of people. I use it also when I catch myself resisting things that are happening. I try to flip it around 180 and say no resistance, open up, use this paradoxical intention, reverse psychology, and see what happens. So give it a shot. Give me some feedback. This is one of the tools that I use in my program with people to help them start to face their pain and face their symptoms in a different way. Thank you very much. Give it a thumbs up if you like it. Pass on the channel to other people. I'm trying to get the word out more and more with these free videos. And if you need any assistance or looking for some support, I do offer that, consultations and support. You can find me at my website, The Pain PT. Take care, everybody. Bye-bye.